You're losing your hair, and you've probably already told yourself the same thing millions of people tell themselves: it's genetic. My father went bald, my grandfather went bald, there's nothing I can do. Here's what I need you to understand before this video is over. Even if genetics is part of your story, and for many people it is, genetics is not the only chapter. And for a large number of people losing hair right now, genetics is not even the main chapter. There are things you are doing every single day that are actively accelerating your hair loss. Not causing it from scratch, accelerating it. Speeding up a process that might have taken 20 years and compressing it into 5. And you have no idea you are doing them. That's what this video is about. First, I need to make sure you understand what is actually happening inside your scalp. Because if you don't understand the mechanism, you can't understand why these habits matter. Every single hair on your head is produced by a structure called a follicle. That follicle cycles through 3 phases: the anagen phase, active growth, which lasts between 2 and 7 years; the catagen phase, a short transition of 2 to 3 weeks; and the telogen phase, rest, which lasts about 2 to 4 months, at the end of which the hair is shed and a new hair begins growing. In a healthy scalp, about 85 to 90% of your follicles are in the anagen phase at any given moment. Only 10 to 15% are resting and shedding. That's why losing 50 to 100 hairs a day is completely normal. It is renewal, not loss. The problem starts when something pushes a large number of follicles out of the anagen phase prematurely and into the telogen phase simultaneously. Suddenly, instead of losing 100 hairs a day, you're losing 300, 400, 500. You notice it on your pillow, in the shower drain, on your brush, in your hands when you run them through your hair. This phenomenon is called Telogen effluvium. And here is the detail that changes everything. It does not happen immediately after the trigger. It happens 2 to 4 months later, which means if you are losing hair right now, the cause is not what you did last week. The cause is what happened 2 to 4 months ago. A stressful period you may not even remember as stressful. A diet change, a surgery, a fever, a nutritional gap that opened quietly and stayed open. Your hair is a delayed mirror of your body's internal state. Now, let me show you the 6 things that are most likely accelerating your hair loss right now, and that almost no one talks about clearly enough. Number 1, you are not eating enough protein, and you have no idea. Your hair is 95% keratin. Keratin is a protein. Without adequate dietary protein, your body cannot produce keratin. Without keratin, it cannot produce hair. It's that simple. When you enter a state of protein deficiency, even a mild chronic one, your body makes a decision. It prioritizes vital functions, organ function, immune activity, muscle maintenance, and it quietly reduces its investment in non-essential structures. Hair follicles are among the first to be deprioritized. The follicles don't die, they enter a resting state, they stop producing, and 2 to 4 months later, the shedding appears. The clinical threshold for concern is ferritin below approximately 40 nanograms per milliliter for women experiencing diffuse shedding. But equally important and far less discussed is total protein intake. Research consistently shows that populations with dietary protein deficiency have significantly higher rates of diffuse hair thinning, and crash diets, extreme caloric restriction, eliminating entire food groups, are among the most reliably documented triggers of telogen effluvium in medical literature. Here is what makes this particularly dangerous in the current moment. Weight loss medications, the GLP-1 receptor agonists that millions of people are now using, have been associated with elevated rates of telogen effluvium in large-scale clinical analyses. And the 2025 EADV Congress data made clear that the cause is not the medication directly. The cause is rapid weight loss combined with insufficient protein intake during the restriction phase. The drug is not destroying your hair. The way you are eating while taking it is. If you are losing weight by any method, do it slowly. Increase your protein intake. Your hair follicles are watching. Number 2, your ferritin is low and no one told you. Iron deficiency is one of the most common, most underdiagnosed, and most correctable causes of diffuse hair loss in women. And the critical point, you can have low ferritin with a completely normal hemoglobin. A standard blood count can come back clean while your iron stores are depleted at the level that matters for follicle function. Iron is essential for DNA synthesis. Hair matrix cells, the cells inside the follicle that are actively producing your hair, are among the fastest dividing cells in the human body. They require an enormous amount of DNA synthesis activity, and that process requires iron. When ferritin drops below the functional threshold, most trichologists and dermatologists consider levels below 40 nanograms per milliliter as potentially contributory to shedding, with some recommending higher targets for hair-specific outcomes. Follicle activity is impaired. Growth slows. The anagen phase shortens. More follicles shift to telogen. And months later, the shedding begins. A study by Cantor and colleagues showed a clear association between decreased serum ferritin and alopecia in women, an association that is independent of anemia. You do not need to be anemic to have iron-related hair loss. If you are a woman who menstruates, a vegetarian, or anyone who has recently lost weight rapidly or undergone surgery, ask your doctor specifically for a ferritin level, not just hemoglobin, ferritin. And if it is low, correct it with medical guidance before buying any topical treatment or supplement. Number 3. Chronic stress has been quietly destroying your follicles for months. This is not metaphorical, this is molecular. When you are under chronic stress, your adrenal glands produce cortisol continuously. Elevated cortisol disrupts the hair growth cycle by pushing follicles prematurely from the anagen phase into the telogen phase. Research published in the Journal of Clinical and Diagnostic Research identified emotional stress as a leading cause of sudden hair loss, with the shedding appearing 2 to 3 months after the stressful period. The data is striking. Approximately 70% of people under chronic stress report increased hair fall or visible scalp thinning, and the problem is compounding because stress also disrupts sleep. Sleep deprivation further elevates cortisol, and elevated cortisol further disrupts the hair cycle. It is a physiological loop that your hair pays the price for. There is another mechanism worth understanding. Stress activates substance P, a neuropeptide released at the skin level, which can trigger local inflammation around the follicle. This inflammation disrupts the follicle's normal growth signaling and accelerates miniaturization, particularly in individuals with a genetic predisposition to androgenetic alopecia. In other words, chronic stress does not just cause temporary shedding. In genetically susceptible individuals, it can accelerate the permanent, progressive form of hair loss by years. Number 4. Your diet is producing DHT at an accelerated rate. This is the mechanism that most people misunderstand about genetic hair loss. Androgenetic alopecia, pattern hair loss, is not caused by how much testosterone you produce. It is caused by the sensitivity of your follicle receptors to dihydrotestosterone, DHT, a metabolic derivative of testosterone produced by the enzyme 5-alpha reductase. If your follicles are genetically programmed to be sensitive to DHT, even normal levels of DHT will progressively miniaturize them over time, but here is what you are adding to that equation without knowing it. High sugar intake spikes insulin levels. Chronic insulin elevation increases the conversion of testosterone to DHT. A study published in BMJ Nutrition connected high glycemic index diets to premature hair thinning in young adults. People consuming over 100 grams of sugar daily were found to have a 25% higher chance of developing early-stage hair loss. Pro-inflammatory dietary patterns, frequent fast food, trans fats, refined carbohydrates, excess alcohol, promote endothelial inflammation, reduce blood flow to scalp follicles, and according to clinical nutrition research by Zhao and colleagues in 2024, correlate with higher incidence of androgenetic alopecia. You are not just inheriting your parents' hairline, you are feeding it or starving it every single day. If you have a genetic predisposition to pattern hair loss, your diet is either slowing it down or speeding it up. That is a variable you control. Number 5, your hairstyles are scarring your follicles. This one is direct and mechanical, and the consequences can be permanent. Traction alopecia is hair loss caused by repeated prolonged tension on the follicle, tight ponytails, high buns, braids worn continuously, cornrows applied under high tension. These hairstyles pull on the root of the hair at the scalp level. Initially, the follicle responds with inflammation. The hair thins at the tension points. If the traction is stopped early, recovery is possible. The follicle is stressed but not destroyed. But with repeated, prolonged exposure over months and years, the chronic inflammation causes scarring. The follicle is replaced by fibrous tissue, and fibrous tissue does not produce hair, ever. Traction alopecia most commonly presents as thinning along the hairline, particularly at the temples and the front margin of the scalp, where tension is highest. And because it develops gradually, it is frequently misattributed to genetics or aging. The people most affected are women and girls who wear protective styles or sleek pulled back styles consistently over long periods. The intervention is simple. Vary your hairstyles, reduce tension, never sleep with extremely tight styles, and if you notice thinning along your hairline, address it before the scarring stage. Protective styles can be both gentle and elegant. The damage is never in the style itself, it is in the tension and the duration. Number 6, you are treating two completely different conditions as if they are the same thing. This is the mistake that costs people the most time, and I need you to understand this distinction clearly before you buy a single product or try a single treatment. There are two fundamentally different types of hair loss, and they look similar on the surface, but their causes, their mechanisms, and their treatments are entirely different. The first is telogen effluvium, the sudden, diffuse shedding triggered by a stressor that occurred 2 to 4 months earlier. Stress, nutritional deficiency, rapid weight loss, surgery, fever, medication, postpartum hormonal shift. The shedding is widespread across the entire scalp. It can be dramatic, clumps in the shower, significant volume loss in a short period. But, and this is crucial, the follicles are not damaged. They are sleeping. When the cause is identified and corrected, they wake up. The hair grows back. This is a temporary reversible condition in the vast majority of cases. The second is androgenetic alopecia, genetic pattern hair loss. Here, the follicles are not shedding dramatically in a short time. They are miniaturizing slowly and progressively over years. Each cycle, the anagen phase is slightly shorter. Each cycle, the hair produced is slightly finer and shorter. The hair doesn't suddenly fall. It gradually disappears, replaced by thinner and thinner strands until eventually the follicle stops producing entirely. In men, this follows a typical distribution: receding temples, thinning crown, progressive balding zones. In women, it is more diffuse. The part widens, the overall density decreases, but the hairline typically remains. When you confuse these two conditions and treat one with the protocol for the other, you waste months or years, and your hair continues to decline while you wonder why nothing is working. Now let me give you the 3 questions to ask yourself right now, today. Question 1. Is my hair falling out suddenly and everywhere, or is it getting thinner and more transparent progressively in specific zones? Sudden and everywhere, telogen effluvium. Look for the trigger 2 to 4 months back. Progressive and localized, androgenetic alopecia, different treatment pathway. Question 2. What happened 2 to 3 months ago? A major stressor, a fever, a surgery, a period of severe sleep deprivation, a crash diet, an antibiotic course, a medication change. These are your suspects. This is your investigation. Question 3. Are there any associated symptoms, scalp itching, burning, pain, redness, crusting, loss of eyebrows or beard hair? If yes, this is not cosmetic. This is a scalp condition requiring medical evaluation without delay. Infections, inflammatory scalp diseases, and autoimmune conditions affecting the scalp can cause permanent follicle damage if untreated. And here is the clinical nuance that changes the outcome for many people. These two types of hair loss frequently coexist. You may have a genetic predisposition to pattern hair loss that was progressing slowly, at a manageable pace, barely noticeable. And then a stressor arrives, a difficult year, a nutritional gap, a hormonal shift, and it triggers a telogen effluvium on top of the underlying androgenetic alopecia. Suddenly, the loss looks dramatic. You address the nutritional deficiency or the stress, the effluvium resolves, but the hair doesn't fully come back because the androgenetic progression was already there, waiting, and the effluvium episode may have accelerated it by years. This is not rare, this is common, and it is why early evaluation matters more than most people realize. The single most important thing I want you to take from this video is this: hair loss is not a diagnosis, it is a symptom. And like any symptom, it has a cause, sometimes multiple causes layered on top of each other. And those causes, particularly the nutritional ones, the hormonal ones, the mechanical ones, are often correctable. Before you spend money on supplements you found on social media, before you follow advice designed for someone with a completely different type of hair loss than yours, get a proper evaluation. A blood test, ferritin, TSH, vitamin D, zinc, complete blood count takes 30 minutes and can identify multiple correctable causes in one appointment. A visual assessment by a dermatologist or trichologist takes 10 minutes and can tell you which type of hair loss you have. That information changes everything. Treat early. The earlier you intervene, the more follicles you preserve, the more options you have. I'm Dr. Maya Roa. Your follicles are not your fate. And if you want to go deeper into something else, your body does, that science is only beginning to understand, My last video on the most mysterious sexual disorders recognized by medicine is right here. You will not expect what's in it. Go watch it.